Am I introducing myself again?
You don't have to introduce it, but just maybe say in this module
Yeah,
we're
sure.
going to.
In Module 1, we're going to be talking about centres engaging Australian schools and why it's important and some practical and simple steps forward so you can work with schools in a helpful way. Every day in Australia, 4 million children are attending an Australian school. In fact, there's over 200,000 teachers working in schools and there's 9,500 school communities. Every school is different and every sector is different. So there's government, Catholic and independent sectors. Every state and territory is also different, so engaging with schools really requires you to have some local knowledge and local understanding. The biggest challenge for centres is demand. Sorry, can I start that again? I might actually do that whole thing again. Do you think it's important for them to know? Probably not all of that stuff, but I just need to say there's 4 million kids in schools and that's where they're at.
I actually think that breaking it down, like saying it's different, what you said was actually quite important.
Okay.
Just as an acknowledgement that
Sure.
this isn't, it's not a cookie cutter thing.
Is this a module? Yes.
It's a module, yeah.
This module is about engagement of schools and working with schools and centres. Every day in Australia, 4 million children go to a primary or secondary school, and there's over 9,500 schools in Australia. Essentially, if Headspace is to work with young people, well, schools is where young people are attending. Every school is different though. Fundamentally, we have to understand that each school may belong to a sector, either government, Catholic or independent. And this offers different resources and different capabilities of every single school. State and territory systems are also very different and have different priorities. And it's important for you to understand the local context of the schools that you're working with. The biggest challenge for centres is demand management. And we know that the more you go and promote your services and your supports, the more your demand management may go up. However, I think fundamentally that the opposite would actually happen if we have better relationships with schools and schools communities. We'll help build capacity of teachers, build capacity of parents and build capacity of students. We'll also reduce the number of mental health concerns that may actually arrive on the doorstep of a Headspace centre. Relationships with schools needs to be simple, efficient and very practical. The essence of this course is about to explore help seeking and mental health literacy from a perspective of prevention through to postvention continuum. I'll talk about this in some simple terms. Headspace centres from 2018 will be playing an integral part in improving mental health reform in schools. We know that Headspace will be working with Beyond Blue and Early Childhood Australia across the country to start improving and strengthening the understanding of mental health for Australian schools. So what we'd like to do is give you some practical strategies in moving forward, but also make it simple and achievable for you to work with the schools in your area. Let me start with prevention. Prevention involves all teachers and all students from a school perspective. Prevention strategies underpin student wellbeing, positive engagement, and it works through curriculum, policies, parent engagement and student voice. Some examples of this is how schools might build mutual respect and promote safety at the school, implement comprehensive curriculum, understand diversity, enhance school attendance, practice inclusive teaching and learning, encourage supportive relationships, ease transitions for kids, and involve parents and families essentially in mental health and improving mental health. Prevention from a centre's perspective is understanding that they can work with schools to help promote the fact that well-being is the precondition to good learning. We also want to build relationships early. So if you're working in a centre and you want to work with a school, be a part of that school community in a way that simply connects them. Have a coffee with them. Find out who is the best person for you to work with and offer some guidance around strategic planning and work with them at different times during the school year so they're able to respond better when early and mild to moderate concerns rise. In working with a school, you can look at this from a prevention way in that you can help guide schools' understanding of what they might do differently. For example, putting up mental health posters and logos in the foyer, having curriculum that responds to mindfulness or CBT, emotional regulation, talking to them about good transition behaviours, how to engage parents. They will often ask you to come in and be a guest speaker. So making sure that you do it strategically in a prevention health promotion way. The next step on the continuum is early intervention for schools. This can be carried out by teachers, wellbeing staff, school leadership, and it focuses on more of an individual or small cohorts of students. The second space on the continuum is early intervention for schools. This can be carried out by teachers, wellbeing staff and school leaders. It focuses on a smaller group of cohort of students, and you might be identifying some small risks. Examples of this is how to identify risks, provide school-based counselling and support, develop programs to improve skills for kids, and monitor and evaluate how those kids are now going. You might do lunchtime or after school programs. But from a centre's perspective, early intervention should be about understanding how we build teacher capacity. You should be talking to schools about better mental health literacy and guiding them about how to get kids to improve their help seeking. Give them ideas and strategies to notice small problems and what can we do to implement small strategies at schools so teachers and parents can resolve some of those problems without having to refer them on to clinicians or centres. This will minimise the situation and hopefully clean up some of the referral pathways. How does that feel?
Yeah, that's good. And we'll have those points up on screen.
The third space is intervention in schools. Now this is where students becoming more vulnerable. Sorry, can I start again? The third space is intervention in schools. From a school perspective, this is where students may be increasing in risk or increasing in vulnerability. Schools need to engage with external agencies or partners, such as Headspace centres, to look at services and supports on how to reduce that distress or risk. Often this requires good referral pathways and implementing staged response so teachers and school leaders can help the recovery and support of that young person. Some examples of this means linking to counselling services, ensuring continuity of care for parents and teachers. So if a young person goes out and attends a service such as a Headspace centre, that they come back with information on how they might improve their situation at the school. We also need to monitor and evaluate the progress of that young person. Centres can participate in case management meetings, understanding, talking with parents, and using the school as a partner to try to address some of the situations arising. Also, intervention may require clinical and therapeutic support over a number of sessions. You need to follow up, be a part of the case planning team, involve parents and teachers where you can, and make sure that schools understand how to not... Can I start that again? Yep. Intervention is also important from centres because this is where you're trying to minimise mild, moderate cases going on to being acute or extreme cases. So working with schools to case plan, involving parents and teachers where you can, having continuity of care and understanding if there's any other clinicians involved, such as a school counsellor, school psychologist, and making sure that this is a strategic and sensible way that we're approaching the intervention for that child. The last space where schools might actually engage with centres in a postvention or understanding the response to suicide. The impact of suicide on a school and a school community can be a really devastating thing. It requires coordinated and specialised understanding, and Headspace centres can play a really critical role in this. So can child and adolescent mental health services. If we do this correctly, increasing awareness and trauma of impact, planning for emergency responses, providing counselling and monitoring recovery will make sure that further mental health concerns in the future for that school community may be minimised. It will shorten the window of recovery, and also it'll make sure that that school gets back onto the proper job of normal health and wellbeing quicker. Okay, now I'm just going to get to a summary of that. So in summary, schools and centres play a fundamental relationship in improving mental health outcomes for children and young people. Consider schools and education systems as a key platform to launching health promotion and prevention strategies. Understand the complexity and challenges of every school context and how their environments are different. Get to know them and have a relationship. Leverage off existing national and state relationships that Headspace or Headspace in Schools, eHeadspace or centres might have. We're all a consistent brand, and when schools meet us, often they just see us as Headspace. Work with local schools to assist in planning for strategic, evidence-based mental health strategies from prevention through to postvention. Fundamentally, be available and be accessible. Work with multiple schools around the same approach. Be visible to parents and teachers and students. This is where they learn to trust our Headspace brand. Continuity of care is important, and when young people come and work with you at the centre, make sure that you learn about their school situation. After all, it's where they spend 6 hours a day. So in your intake process, ask what school they're going to, ask what the school is doing to help them, and then offer to work with the school to help their situation. Essentially, there's two really big things centres can do: build mental health literacy and build help-seeking skills. Be innovative, try different things with schools, assist schools in becoming a mental health hub of their community. Monitor referrals that come in, and if you consistently get the same referral from one school, all about self-harm or self-injury, then choose to go and do something proactive with that school. Build capacity of teachers, look at their policies, look at their resources and planning. And then you may fundamentally reduce the referrals coming in for self-harm and self-injury. Yep. One of the key things we can do is look at referrals coming in from schools, either individually or as a network of schools. If we can understand referrals and presentations from those schools better, we can then respond better in a more strategic way. For example, if over a period of months you have one or a handful of schools consistently referring self-harm and self-injury to you, then maybe work with those schools in a more strategic way. Go and build capacity of teachers, help them with resources, choose to talk to parents and kids about self-harm and self-injury, help them with their school policies and referral pathways. This may actually
Just go from this may actually.
Yep. This may actually reduce the referrals for that particular presentation or type. Does that make sense? Or type? This may actually reduce particular presentations or the volume of presentations coming in from certain schools or school networks. The last thing I'd like to say is that you can always talk to schools about using fee for service. If you go out to schools and you think, we don't have a lot of time to do this and we actually don't have a lot of resourcing, schools often have a budget, but they don't know what to do in mental health sometimes. So if you offer them an idea and a good evidence-based strategy, they may actually fund you to come and work with the school. And it doesn't hurt to talk to them about looking at year-long relationships and how that may be resourced for you and your staff. What have I missed? I don't think. I kind of went all over the shop.
Pretty comprehensive to me.
Do you reckon?
Impressive, yeah.
Okay. All right. Let's move on to the next one, which I'll do suicide post.